And it's my pleasure to introduce and welcome to the stage Cathy Evans, Chair of Trustees at Retina UK.
Thank you, Lauren. Good morning. I'm Cathy Evans and I'm the Chair of the Trustees, and I am delighted to welcome so many of you to the Retina UK Professional Conference, whether you're here in London or joining us today online. I became Chair of the Trustees in 2024, and before that I was the Chief Executive of the Royal College of Ophthalmologists. I retired 2 years ago. So I've known of Retina UK for many years, and I've always admired its work. And now I know it even better, I am even more in admiration of this small but mighty charity. And Retina UK really does punch way above its weight. And we're the only charity in the UK dedicated solely for working for people with inherited sight loss. Retina UK is marking a significant milestone in its history, 50 years. So I'd like to take a moment to reflect on those small beginnings and the impact the charity has had over the years, the difference it makes today and its plans for the future. Now, some of you may know that our founder, Linda Cantor, recently passed away, and she will be greatly missed. Linda was diagnosed with retinitis pigmentosa in the 1970s, when very little was known about the condition. And she was frustrated and aghast, frankly, about the lack of information available about her condition. And she set about changing that, not just for herself, but also for others. So in 1975, she held the first committee meeting of the British RP Society, and the following year, the organisation was registered as a charity. And over the years, through sheer determination and a very persuasive personality, Linda forged a community of like-minded people who were all determined to make a difference. And her first fundraising event in 1975 made a profit of £187. And now, 50 years on, more than 18 million has been invested in medical research into inherited sight loss. So research has always been a focus of the charity, and I'm going to run through a few milestones of note. So in 1980, there was the launch of the Eye Donor Scheme, and by December of that year, the first 5 donor eyes were used in research. In 1989, Dr. Peter Humphreys and his team at Trinity College Dublin located the world's first RP gene. In 1990, Professor Ropers in the Netherlands, who was partially funded by the Society, identified, isolated, cloned, and sequenced the gene for chloromedia. In 2005, a laboratory in Manchester became one of the first in the UK to receive NHS approval for their genotyping of RP patients. The Gene Project started in 2011, which explored the viability of gene therapy as a treatment for RP and related conditions, and it built a pipeline of clinical trials. In 2014, the UK Inherited Retinal Dystrophy Consortium discovered 7 novel disease-causing genes, plus a further understanding of the role of 10 other genes. There was a huge milestone in 2020 when the first patient in the UK was treated for an inherited retinal dystrophy, and Luxturna is still currently the only available NHS-funded treatment for an inherited sight loss condition in the UK. And coming up to date this year, Great Ormond Street Hospital announced the successful treatment of 4 children with Leber's congenital amaurosis, a therapy evolved from the Gene Team project. So you can see a lot of things to celebrate in 50 years. But Retina UK isn't just about medical research and milestones. We're also committed to supporting people to live well today. We provide a range of emotional and practical support. These are free of charge to anyone who's affected by inherited sight loss, and to you, the professional community who support them. They include a helpline, which was first introduced in 1987, and 2 of our volunteers who sat on the Welfare Committee at the time will be joining us tomorrow at the annual Congress. So they're still volunteering with us so many years on. Last year, we received 633 calls and answered 282 emails. And calls can vary in topic and length and can be a few minutes or over an hour. And we're often the first organisation that people turn to after a diagnosis. People are overwhelmed, anxious, fearful for the future. We're there for them. And thanks to Retina, no one should be facing the future alone. Then there's our growing network of peer support groups, many held locally around the country, where the community can get together, share ideas and support one another. We also have a range of online-only groups and specialist groups for young adults, women, men, and those with specific interests. Last year, 1,206 people registered to attend our peer support group meetings. We've over 1,000 already this year. And there were 85 group meetings last year, and this year we're already had 66, so we're on track to surpass that number. Our community tell us peer-to-peer support is invaluable, and the impact of speaking to others with inherited sight loss is life-changing. So I would like to take a moment to thank our committed volunteers, without whom we couldn't deliver our work. And they've been the lifeblood of this organisation for 50 years. Then we have our information services, including our website, newsletters, webinars and podcasts on a wide range of topics so that people have the knowledge they need to make informed choices. But the question is, how do we know where to focus our work to ensure the best use of our limited resources today and in the future? Well, we have a 3-yearly tracking survey which shows us clearly where improvements are most needed in health and social care, in research and daily life, emotional well-being and access to support and technology. Most recently, it guides how we shape our services and priorities to ensure we're meeting current needs. The survey is just one of many ways we ensure lived experience is at the heart of everything we do. And you'll be hearing more about the findings of the most recent survey, the 2005 survey, from Tina Garvey, our Chief Executive, shortly. And I hope you find those insights useful in your daily practice. We will be hearing from a panel of young adults about their lived experience later in the morning, and I believe this will be a very powerful and insightful session. Our first professional conference took place in Milton Keynes in 2019, and since then numbers have grown steadily, as have our relationships with you. By working in collaboration, we can achieve better outcomes for those families affected. 2 years of work led up to the publication of the Sight Loss Pathway in 2023, informed by detailed research and the insight of more than 500 people with lived experience and more than 30 bodies who represented professionals and patients across the sector. More than 20 organisations have endorsed the eye care support pathway. The publication of the pathway was a significant step towards working together to create positive change for those diagnosed with sight loss, and we're now working in collaboration with the RNIB to create a pathway specifically for inherited sight loss. From the moment someone realises that something isn't quite right through to diagnosis, we'll be able to help them. We're here to ensure families can access the information and support they need to be active participants in their care. We've seen a significant rise in referrals from the professionals in our community to our charity. Please do continue to signpost those you support to us. We're really thrilled that despite heavy workloads, so many of you have chosen to join us today. We have a fantastic learning opportunity, and valuable time to reflect on our practice. For those of you here in person today, it's also about meeting others, networking and building relationships. I hope that you'll form many new connections and collaborations will be made in the coffee breaks and over lunch. Today, you're among colleagues with a wide range of professional backgrounds. Your roles may be varied, but it's your common desire to deliver excellent services for those living with inherited sight loss and the things that brings you together to attend this event. And tomorrow, we'll be joined by 400 community members for our annual Congress. Many will be attending for the first time. In fact, some of them will be meeting other people with inherited sight loss for the first time. And as for the future, the staff, team and trustees take our responsibilities to safeguard the future of the charity very seriously. And while much has been achieved over the past 50 years, much remains to be done. Until such time where there is a treatment or a cure available for all, and we're no longer needed, we will work hard, innovate, and be ambitious for those we serve. So we're proud of the difference we make, but we want to do more. And with our passion and hard work, and the ongoing support of our amazing community, we will make a difference. So individually and collectively, we can improve the lives of people with inherited sight loss. And I know that we will do just exactly that. So thank you very much for attending, and I do hope you enjoy the day. Thank you.